Hi, Maddie.
Hi.
How are you today?
I'm good, thank you.
Wonderful. Well, I see here that you made an appointment with us again. And before we begin, can I please verify your date of birth?
July 23rd, 2005.
23rd, 2005. Okay. And your address, please?
512 Dowdhurst Lane.
Perfect. Okay. So go ahead and tell me what's going on today.
For the last couple of days I've been feeling some pain in my throat and some redness as well. So I'm not sure what's going on there.
Okay. And for how long has that been going on?
It's going on for about 4 days.
4 days, okay. Any fever with that?
There was a fever for 1 day, about 101.
Okay. Are you having a fever right now?
No, not today.
Okay. Any, let's see, any nose stuffiness or
Some nose stuffiness, yes.
runny nose,
No runny nose.
cough?
Just a little cough.
Okay, is it dry or
It's like dry cough, yeah.
Okay. Let's see what other information we have. When was your last flu vaccine?
It was, I believe, January 15th when I got it.
Okay. Wonderful. So what I'm going to do today is I'm going to give you a very thorough exam. It's going to be head to toe just to make sure that we're not missing anything, and then I will definitely focus on your upper respiratory part so we can figure out if it's viral or bacterial infection.
Okay.
So I'm gonna put some gloves on. And on a scale of 0 to 10, how bad is your pain in your throat right now?
It's about a 6.
Okay. Have you been taking any medications or?
I've been trying to just take some like ibuprofen to lessen the pain.
Okay. So I'm gonna have to make sure that you're not dehydrated, and probably will definitely going to encourage lots of fluids for this. I'm going to slowly palpate your head. Is that okay?
Of course.
Okay. And now I'm gonna go ahead and check your lymph nodes. Any pain here?
A little.
Is it on both sides or?
Yes, both sides.
Yeah, definitely your ganglions are a little bit inflamed. I'm not feeling anything abnormal. Let's go ahead and check your temperature. Okay, never know where this goes. Something like this. Okay, it's going to go underneath the tongue. Go ahead and close. Perfect. Go ahead and open. 99.5. It's definitely not a fever, but you're very close. Okay, I will take your oxygenation. This is going to go on the index finger. Okay, go ahead and relax. Take a deep breath in. Good. Okay. Heart rate a little bit elevated, which could be an indication of infection, and your oxygenation is 98%, so that's very good. Okay. I'm gonna go ahead and listen to your heart and your lungs. I'm going to put the stethoscope on the chest. Is that okay? Can you take a deep breath in and hold it in? 1, 2, 3. Okay, go ahead and exhale. Can you please lean forward for me? Okay. Take a deep breath in. Hold it for 1, 2, 3. Good. And exhale. And I'm going to listen with the bell as well. You can breathe normal. Very good. I'm not hearing any signs of murmurs. Okay. So no heart abnormalities. Can you please take a deep breath in and breathe out? Okay, good. Let's do that one more time. Take a deep breath in and breathe out. Okay. I'm going to listen to the side. Is that okay? Okay. Just lift up one arm. Good. Take a deep breath in and exhale. Okay, and I'll do the same thing on the other side. Take a deep breath in and exhale. Okay. Is it okay if I listen to the back?
Okay.
Okay, go ahead and take a deep breath in for me and exhale. Good. Same thing. Take a deep breath in and breathe out. Good. Again, breathe in and now breathe out. Good. And again, take a deep breath in and exhale. Okay, so no signs of pneumonia there. I couldn't hear any crackles, wheezing, or bronchi. I couldn't feel any lymph node enlargement, but there was some tenderness. Okay, your temperature was 99.5, heart rate 110. That's per minute. Okay, Maddie, is it okay if I do a mouth and a nose exam?
Yeah, of course.
Okay. Can you please give me a big ah? Okay, see, there is definitely a little bit of redness. Good. Okay, and I'm not seeing any white spots. Uvula is midline. Soft palate and hard palate are normal color. And no signs of inflammation, so that's very reassuring. Okay, so what we have to do is we need to take a swab of your mouth. Is that okay? Like in your throat?
Mm-hmm.
We're going to send that to the lab. And it's called a culture, so we're definitely going to test you for bacterial infections and for viral infections.
Okay.
So go ahead and give me a big ah. Okay, and on the other side, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, and we need to take one more. The first one was for any bacterial infection, and this one is going to be for viral. Okay, go ahead and give me a big ah. Good. 1, 2, 3, 4, 5, inside your nose. Okay. Go ahead and relax. Okay. And on the other side. Okay. I'm gonna go ahead and take a swab of your nose as well. This is obviously for extra precaution. Okay, go ahead and look up. Good. And go ahead and look up. Good. Okay. Okay, now I'm going to go ahead and take a look inside your ears as well. Are you feeling any pain?
No.
Okay. So go ahead and look that way for me, please. Tympanic membrane is pearl gray. I'm seeing a little bit of redness. Okay, no extra discharge. Alright, let's go ahead and take a look inside your other ear. Okay. Go ahead and relax. Okay. Same thing on the other side. So I'm just seeing a little bit of redness, but no signs of any ear infection. Okay, I'm going to check your hearing with a tuning fork. I'm going to put it right here behind your ear. And let me know if you feel any kind of pain. Also, tell me when you don't hear the sound anymore.
Okay. Don't hear it anymore.
Do you hear it now?
Yes.
Okay. Oops. Okay. Tell me when you don't hear it anymore.
Don't hear it anymore.
Can you hear it now?
Yes.
Okay. Perfect. And I'm gonna go ahead and check your sense of taste. Make sure that you still taste everything and everything is intact. I'm going to put one drop on your tongue. Please tell me what this tastes like.
Watermelon.
Okay, good. And let's go ahead and try one more just to double check, make sure that we are not getting a false positive.
Coffee.
Okay, perfect. Alright. Next, I'm gonna go ahead and check your eyes. Can you please look straight at my nose and keep on looking at my nose? Good. And I'll keep on looking at my nose. Perfect. So your pupils are round and reactive to light. Let's go ahead and measure your pupil size. Good. So I would say it's about a 3, which is perfectly normal. I'm going to check the inside of your eye next. Make sure that there is proper color. I'm not seeing any redness, no yellowish color. And same thing on the other side. Just going to gently press down. Perfect. Okay. I'm going to check your peripheral vision. Can you please cover one eye? We're going to do the same thing. And now go ahead and tell me how many fingers you see.
1.
Good.
2.
Good.
3.
Okay, perfect. Now tell me when you see my fingers in your field of vision. I'm going to come just a little bit closer. That's perfect. Okay.
No.
Good.
No.
Good.
No.
Perfect. Let's go ahead and switch eyes. And tell me how many fingers I'm holding.
5.
Good.
1.
Good.
3.
Perfect. And I'm going to come a little bit closer. Now go ahead and tell me when you see my fingers in your field of vision.
No.
Good.
No.
Good.
No.
Good. Okay, wonderful. Everything looks very good. Let's go ahead and check your color deficiency. Okay. here. Perfect. Can you please trace this number for me and tell me what number you see?
Number 8.
Good. And the next one?
Number 6.
Okay, perfect. Can you please cover one eye for me? Good. And tell me what number you see here?
57.
Alright, go ahead and cover your other eye now. What number do you see?
29.
Great. And one last one. Can you please tell me what number do you see here?
I don't see one.
Okay, perfect. I'm going to just check the patency of your nails. Can you please breathe in, breathe out? Good. And same thing on the other side. Breathe in, breathe out. Okay, so this one is a little bit more obstructed. Can you please tell me what this smells like?
Strong coffee.
Okay. Okay. Let's go ahead and cover again one eye. And now tell me when you see the red ball in your field of vision.
No.
Good. Let's go ahead and switch.
No.
Okay, perfect. And was this red the same amount of red on both sides?
Yes.
Great. Okay, Maddie, I'm gonna have you lay down and I'm going to examine your arms, your belly, your back, and then your legs.
Okay.
Okay, Maddie, are you feeling comfortable? Alright. Is it okay if I listen to your belly?
Yes.
Okay. And is it okay if I lift up the shirt up to here?
Yeah.
Okay. Okay. So I'm hearing normal bowel sounds in all quadrants. And is it okay if I gently tap on your belly? Okay. Let me know if you feel any kind of pain. Okay. And I'm going to gently palpate. Let me know if you feel any kind of pain. I'm trying to see if I feel any kind of lumps. Any pain here?
No.
Good. And any pain when I press down?
No.
Okay, perfect. So there's definitely normal organ sizes. I'm not feeling anything abnormal, but I do see here a mole. Have you ever had it checked?
No, I've had it since I was birthed.
Okay. So it's definitely symmetric, but I am noticing a little bit of black inside of it, although the majority of the color is brown. Okay, margins are well defined, but I would still want to have it checked just to make sure. And if we see anything, abnormal, anything that's not supposed to be there, then we'll definitely suggest maybe microsurgery for it.
Okay.
Okay. Okay. sample extraction. Okay, can you please confirm your name and your date of birth?
Yep.
Perfect. Okay, I'm going to put the shirt back on. And is it okay if I tap on your upper chest as well? Okay, perfect. Is it okay if I examine your hands? Okay, I'm going to lift up. Okay. I'm not noticing any redness. Most look intact. They're normal in size and color. I'm noticing some scars. These seem to be very old, at least a few months. And I want to say that they're from an animal. Do you have a cat?
Yes, I have one.
Well, she's very wild, that's for sure.
Yes.
Okay. I have to ask this everybody. Do you feel safe at home?
Yes.
That's good. Okay. Any pain?
No.
Okay. So Capley refill is within 2 seconds. I'm not noticing any splinter hemorrhages, normal skin. Okay. I'm going to go ahead and check your pulses. Good. Good. I'm going to go ahead and compare with your other arm. Good. Go ahead and relax this one. Good. And I'm going to put down the sleeve. Is it okay if I go on the other side? Okay. And is it okay if I lift up the shirt as well?
Okay.
Capley refill is within 3 seconds. Any pain if I press down? Normal pulses. Perfect. Okay. No edema. Both legs have the same temperature. They're warm, dry. And I'm going to go ahead and try to find your pedal pulses. Okay, I would say 2+, symmetric and synchronizing. Okay, Maddie, go ahead and stand up for me. And I'm going to just discuss with you a little bit about the plan of care, what I want to do today. So we did almost like a head-to-toe assessment. You were very close for your annual again. And you're having pain, redness. So we are sending both labs. I'm going to have the results in 24 hours. We're going to test for viral and bacterial infections. And I didn't notice any ear infections, no infection in your nose either. And I couldn't hear any ronchi, no wheezing, no crackles, so I'm not noticing any signs of pneumonia. You had 99.5 fever. Okay. So I believe I will give you a call within 24 to 48 hours. If you're feeling, still sick in a day or two, then probably we're gonna have you return and do more tests. Is that okay?
Okay.
Perfect. Thank you so much for coming in today, Maddie. I'll see you back soon. Talk to you soon.